Pancreatic cancer is the third leading cause of cancer mortality in both males and females.
Middlesex Health offers screenings for people who have a higher risk of that due to family history. And joining us now, we have the Chief of Gastroenterology Dr. Nadeem Hussain, along with Surgical Oncologist Dr. Chia-Chi Wang, who is going to tell you what you need to know. We want to welcome both of you here to CT Style.
Thank you.
So we're talking about pancreatic cancer today, and 10 to 15% of the cases are genetic. It's hereditary. So there are some screening options people should go through, correct?
Yes, exactly. We want to identify those patients who have a family history, or if they have a genetic risk factor such as Lynch syndrome or other syndromes that can be associated such as melanoma. And if those patients are somehow routed toward us or discover us, then we can get them through the appropriate screening.
Yeah. And Dr. Wang, you were mentioning beforehand how important this is to get screenings, because oftentimes it can sometimes be too late.
Exactly, because the symptom might be very subtle, you know, nauseous, vague abdominal pain, weight loss, or even starting light jaundice, like your skin turn yellow. And some people don't notice that, and that's the little telltale sign of it. If you can detect it early, surgery, including different treatment, obviously, chemotherapy, radiation therapy, all this combined can help patient, you know, battle this disease.
But if you detect it early, there are great chances of survival and recovery, right?
Exactly. It is a deadly disease, obviously, and a lot of people know about. We recently had this, you know, celebrity, Mr. Alex Trebek, who was diagnosed with that, and I think he's diagnosed stage 4 disease, and obviously he didn't know about it. And that's why the screening test is important, and if you're eligible, Middlesex Health do provide that program.
Yeah, talk to us a little bit about how you're able to help families, especially people who might be at high risk.
So if somebody has a relative with pancreatic cancer, or if they have more than one relative, especially on the same side of the family, they'd want to talk with their doctor about being considered for genetic counseling and possible genetic testing. And depending on which genetic factor they have, then they can undergo testing, or even if they don't have a genetic abnormality but just have the family history, then MRI imaging of the pancreas can be performed. There's also the option of endosonography. That's where we pass a scope through the mouth into the stomach and use an ultrasound and take a detailed look at the pancreas from the stomach or the small intestine. And depending on what abnormalities are seen, we can actually pass a needle through and take specimens, you know, tissue or fluid, and send it for testing. And
it's pretty advanced technology there, yeah.
Yeah, certainly. We in Middlesex provide pretty comprehensive one, and a lot of time we give patient a lot of information, but we guide them through. We have a whole team. We have nurse navigator in our cancer center, because they do have a lot of needs, not only medically, socially.
Well, it's great that you're able to help the family, and especially with a disease that can be genetic like that. So
catch it early. So just for our viewers, just explain the importance of getting these tests and catching everything early. It's life-saving, right?
Yes, exactly. So depending on what the risk is, if somebody is a smoker or if they're obese, their risk might be higher. So we have to combine everything, including history of alcoholism. All those things are toxins for the pancreas. So if we can identify those people, find out what their risk is, we can be more and more aggressive with the screening. So some people need testing every 6 months, some people maybe once a year, and that way we can tailor treatment toward that.
Well, a lot of important information, doctors. We want to thank you for joining us here on the show today, and be sure to log on to middlesexhealth.org to learn a little bit more about pancreatic cancer screenings right here in Connecticut. Thank you.
Thanks.
Thank you.